Hello, my name is Chris Holdroyd, and I'm a daily analytical contributor to StockTwits, which is a social media platform for stock traders. I go by the stage name, The Laughing Investor, as I try to examine the lighter side each day as traders risk thousands of dollars on rumors and accidental keystrokes. It's an anxiety-prone business, and you should not forget to occasionally laugh at yourself and sometimes others. Today, I've got a great stock for you to add to your watch list. It's called OptimizeRx, ticker symbol OPRX. The best way to describe their business model is to remember the days when some people who undergraduated university, who were particularly physically attractive, became well-paid drug sales representatives pitching drugs to doctors at their offices for Big Pharma. Well, those jobs are about to disappear. It turns out these days, 46% of doctors won't see pharmaceutical sales reps in person. And 55% of healthcare providers limit sales rep access. OptimizeRx is a disruptive technology company and has found a cure for slow, low-yield, expensive personal selling to doctors. So, what are doctors doing with all their spare time besides treating patients and avoiding sales reps? It turns out doctors spend much of their time looking at electronic health records on their computers. Physicians use their EHR networks daily, staring at their computer screens for an average of 5.9 hours per diem. OptimizeRx directly taps into these EHR networks with their own proprietary network and content. They connect without a salesperson middleman and influence doctors to prescribe newer or appropriate drug treatments they promote on behalf of their clients. The pharmaceutical industry are their main clients. Their direct network bypasses the costly, good-looking sales reps sporting a BMW, interrupting doctors on the clock hours with gifts from Starbucks and free packets of Viagra. Disclaimer: Viagra and laxatives are incompatible. You won't know if you're coming or going. So, how did OPRX do this? There are 370 EHR network systems in the United States, and the OptimizeRx platform travels through all of these to reach doctors through their individual office connections. As of today, they reach 60%, or 480,000 of all prescribing physicians in America. And how does OPRX work? You know how you hear about a drug treatment, a new drug treatment for a serious disease, but it seems to take years to reach the public? Well, one of the reasons Big Pharma's flocking to Optimize proprietary online conduit is they can now go directly from FDA drug approval to doctors' eyeballs via the OPRX network. 80% of the top 50 pharma brands pay OptimizeRx directly to reach the 480,000 doctors they do. And they do it immediately. And they do it to influence the sales of their new medications and replace older or now generic drugs from other manufacturers with newer improved ones of their own. Now, these doctors are 3 times more likely to prescribe a particular drug, and a 60% increase of monthly drug prescriptions are generated using their platform. Typically, doctors access newly available drug treatments at precise decision points in the clinical workflow of their diagnosis. This is obviously the most effective, accurate pinpoint moment in time for OPRX influence to work on a sale, and it is the perfect defense against any future competition. Now for the financials. This chart brings tears to my eyes. It's absolutely gorgeous. It looks that way because OPRX has had a 51% compound annual growth rate from 2011 to today. And recent Q3 revenue was $10.5 million, up 110% versus Q3 2019. OptimizeRx is reporting its fourth quarter and full year 2020 on Wednesday, February 24th. The company expects to report record revenue for the quarter of more than $16 million, up 117% from the same year-ago quarter. They are also expecting their first positive GAAP net income. Typical of high-growth companies, their strategy is to first gain dominance in market share before worrying about the bottom line. Just think Amazon. So, put OPRX on your watch list. Hope you enjoyed this show. Please click subscribe below. Chris Holdroyd, the Laughing Investor, signing off. Have a nice day.